It's time to get the story behind the story. Interviews with newsmakers, news breakers, and Vermonters making a difference. WCAX presents 802 News with Mark Johnson. Here's Mark.
Bill Schubart is a former board chair of Fletcher Island Healthcare, which is now the University of Vermont Medical Center. A retired businessman, he frequently writes about healthcare policy for Vermont Digger. In this edition of 802 News, sponsored by Red Hen Baking Company, Schubart discusses why he believes Vermont's healthcare system is at a key tipping point, with costs rapidly rising and accessibility diminishing. At some recent free clinics, folks with serious medical conditions have slept in their cars overnight to improve their chances of receiving care. We'll begin our discussion after a word from our sponsor. At Red Hen Baking Company, they believe pure, uncomplicated ingredients in the hands of skilled artisans are the building blocks for great food. They're dedicated to creating the best food from the best ingredients. You'll find an ever-changing lineup of delicious pastries, sandwiches, and soups at their beautiful cafe off Route 2 in Middlesex, just off I-89. Their breads are also available in many other locations. Led by owners Randy George and Eliza Kane, Red Hen Baking Company has been on the leading edge of the local food movement since 1999. Let me see if I can set the scene somewhat here. The medical system in Vermont really seems to be, the word crisis is overused, but I don't think it is in this case. You've got 9 of the 14 hospitals were operating in the red. The Green Mountain Care Board just approved double-digit increases in health insurance for the third year in a row. The biggest insurance company seems on the financial ropes. Finding nurses and keeping them seems to be a problem. Financially, this, you call it being at a tipping point. That almost sounds generous. Why did you use that term?
Well, because
and what do you think of my assessment?
I'm an eternal optimist, and I actually think that sometimes things have to break before you fix them, and this is so close to the tipping point of really breaking in a serious way. Given the data that's come up and the amount of waste in the system, and I think when this really blows open, it'll give us an opportunity to put together a group of people, of which there are many very bright medical professionals, to sit down and say, what should a healthcare system that serves Vermonters look like? And the definition is population health, and population health is simply defined as quality, access, and affordability. We have quality, although it is declining somewhat, but we do not have access or affordability. So the system is broken. But I think there's a fix.
How did we get here?
We got here because when the Green Mountain Care Board started under Con Hogan, it was taken very seriously. But then when Con left, the people who succeeded him didn't really understand that they were regulators. And for the most part, they gave the hospitals whatever they asked for. And that was a period of just skyrocketing costs. And then Owen Foster came in, and Owen's background at the Department of Justice.
Yeah.
Then Owen came in and said, wait a second, we have a statutory obligation to actually regulate, to not just approve. And the whole culture changed. Part of the big challenge, I think it's fair to say, Mark, is that the enabling legislation, the budget, the legislation set, the calendar, it was all set up wrong. First of all, they need more money, not a ton of money, but they need more money to do data analysis. The idea of determining the premiums for insurance companies before you do the hospital budgets is ridiculous, because the nonprofits have an obligation to just pay the bills, whatever they are. The for-profits, of course, can play games. Again, I think it's really critical that the Green Mountain Care Board get some reauthorization, but they're functioning really quite well. I know all the members personally. They're really committed to making the system work. And as you know, there was still is a significant effort to undermine them. I think that, and I've talked with her twice about this, I think, Senator Ginny Lyons really just doesn't feel we need this. And we do. Vermonters do.
Need what?
A regulatory body.
But the chair who you mentioned is quoted in this most recent round of approvals of health insurance premium increases or approvals. But it's 3 years in a row they've approved these double-digit increases, and at the same time he says, well, he's sort of wagging his finger and saying they really need to do a better job. But actions and words don't seem to be matching up here.
Yeah, I mean, so much of this, and this, I've had 2 conversations with Dr. Sonny Eppen, and what I hear consistently from is, Bill, it's way too complicated. You'll never understand. You don't understand. Don't even try. And my response has been, you're right. I don't understand all the intimacies of your accounting. But at the 30,000 foot level, I do understand what's working and what's not working. And I have to tell you, I think the system is, and again, you don't understand. He's saying the same thing to the Green Mountain Care Board.
Eppen is the CEO of the University of Vermont Health Network, which includes the University of Vermont Medical Center, 2 other hospitals in Vermont, and 3 in New York, as well as UVM Home Health and Hospice.
The fundamental disagreement, Mark, is in the accounting. What the hospitals say they need. Have you seen Tom Rees's data that Bruce Hammery has? It's public information now. Somewhere between 170 and $280 million worth of waste in the system. Unnecessary procedures, unnecessary diagnostics. And if I had to distill it down to one primary problem, the hospitals, you can't be a hospital in Vermont unless you're a nonprofit. You can't get a certificate of need. Nonprofits don't compete. They collaborate. Vermont hospitals compete ferociously. They want more business, more revenue, and UVM Medical Center is the prime example. They do stuff that a tertiary care hospital should not be doing. They do primary care in the emergency room. There's no more expensive place on earth to do primary care, even if you wait 3 days, than an emergency room. They do hospice. They do aging. They do chronic disease management. They want it all because they want all the revenue and they want the referrals upstream. If they were required to be a tertiary care hospital and only be dealing with high acuity patients, they could function very well financially. But when you try and be all things to all people, you're wasting a ton of money.
Let's go back here. So who do we blame? I mean, who's dropping the ball that we're now in a system where you and I are paying these double-digit increases for health insurance every year? You're saying there's not enough accessibility, and you've got the hospitals losing money. So, I mean, where's the problem?
Well, first of all, I challenge the thing of the hospitals losing money. I mean, if all hospitals in the system had the same auditing firm, used the same terms, same definitions, you'd see something very different. But second of all, it's so obtuse, their accounting. When Dr. Eppen was confronted with the Tom Rees data, Sonny Eppen came from, I believe, Mass General or Brigham and was hired up here. And, he's a phenomenal entrepreneur. And, he's going to do everything. And they're going to use all their power they can in lobbying, in lobbying the legislature. And I met recently with the head of the Vermont Business Roundtable, which I chaired many years ago, and they have an intrinsic conflict. Dr. Eppen has been appointed to their board because of the size of their budget. They're one of the major financial contributors to the Business Roundtable. So he gets carte blanche to be the keynote speaker, to 100 some odd executives and tell them exactly what he wants them to hear. When I met with the chair and Seth Bowden, the president, they said, well, where's the conflict? And I said, wait a second. You have 100 members. They pay $13,300 per employee per year for their health care. It's one of the fastest growing costs in business. You have an obligation to help them manage and lower that cost long term. That's the conflict. But, they work the legislature ferociously. There are some legislators who are in their pocket, and I'm very defensive of the legislature. People say to me, the legislature, they should only be in session for 1 hour a year, blah, 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 blah. I say, no, excuse me. I've known legislators going back to Dean Davis. These are hardworking, deeply committed people who want to do the right thing. The difference is, in Dean Davis's time, they were considering questions like, should we sell whiskey on Sunday? Should we have daylight savings time? Now, any one of the major beats, criminal justice, technology, healthcare, financing public education, any one of those, nutrition, housing, is a college degree in and of itself. And
they have no staff. They have no support.
They have no. I mean, Ledge Council and, the financial group is this just not, they don't have the support systems they need. And I'm very defensive. I mean, I know some legislators, and they work their tail off. And what I hear from a lot of them is, it's so hard, we tend to believe the last person who talked to us. The other really big issue, and this is haunting me, and I've talked with the Vermont Community Foundation about this, is that since all hospitals by law have to be nonprofits, the end accountability and liability is not the president of the hospital, it's the board. The president serves at the will of the board. I've chaired, as you know, a lot of statewide organizations. I've overseen 8 leadership changes, and they were not easy. But they were situations where the president was being held accountable and failing on mission. The boards of these nonprofit hospitals, for the most part, really have no idea what their obligation or liability is. They look at the material that's presented to them by the president, and they go, I got it. But it's delivery on mission. Are you delivering population health? And in most cases, the answer is no.
Is part of the problem us, too, that our expectation, because I know you've written about having some hospitals become really basically high-end primary care. If you want an organ transplant, you go to Boston, don't look for a Vermont hospital to do it.
Yeah.
So is part of the problem Vermonters' expectations are too high?
I think that's part of it. I mean, part of it is if you go into a community and say, we're going to close your hospital or we're going to change it, because we definitely have too many hospitals. I mean, a lot of people agree about that. You don't have to close the hospital, you change it. If I were to bring all this down to a simple statement, it would be this. From universal home visits, which they have in Costa Rica and Cuba and other countries, up to small practices, up to primary care facilities, up to local clinics, up to FQHCs, federally qualified health centers, up to critical access hospitals, up to tertiary care. If our investment, if we took the waste out of the tertiary care system and invested it upstream, everything would be much more efficient. It's infinitely cheaper and more effective to treat someone in their community. And we have an aging population, and as a friend of mine says frequently, we forget. Vermont is old, small, and poor. We have pockets of great wealth, but they are pockets. And some of them are, snowbirds. But in general, we're old. And the more we can do in our communities, the more accessible it is. I've had older people in small towns say to me, I've told my family, if I get really sick, stroke, heart attack, whatever, do not call an ambulance because I can't afford it. I want to leave my money to you. I'd rather die and have the money intact than give it all to the healthcare system. That's a heartbreak.
But, the medical system, it seems like a lot of other things in life where it's reactive as opposed to proactive. So the idea of helping people with nutrition to deal with their diabetes, that's just not how we do things in this country.
It's not. My new column is about criminal justice. And, if we took money out of our conventional prison system, and I gotta tell you, I think our corrections people are doing they're going in the right direction, I believe very strongly. But if we invested that upstream in education prevention, what we've done is we've criminalized, and it's a perfect metaphor for the healthcare system. We've criminalized mental illness, substance abuse, and poverty. If you invested in those, you'd have far fewer people in the criminal justice system. You'd have far fewer people in the hospitals. I mean, I've often said, if you want to look at the exemplars of our social and economic failures, look at our prisons, our emergency rooms, and our classrooms.
What's the classroom part?
The classroom part is that we are trying, and God bless us for trying, we're trying to feed, take care of, provide shelter for our children. When I was a kid growing up in Morrisville, it was purely about education. The family and the community had an obligation. If that was being met, then everything was fine, and it wasn't always. But when we don't invest, when people can't have a house, can't have adequate nutrition, the kid comes home, from third grade and there's nobody there, and there's social media and Pornhub and TV that we don't regulate, then these kids end up in the classroom. And I've written about this too. If it was just about hiring and paying teachers, public education would be a lot more affordable. But when you're trying to hire psychologists, guidance counselors, psychiatrists, nurses, expanding your hot lunch program because kids can't learn when they can't,
All right, let's take the medical system. So we spend how much on healthcare total here in Vermont every year?
I've heard several figures, but the number I typically hear is $5.5 billion total.
Okay.
So that's in an $8 billion total budget. What does that say?
Mm-hmm. I'm not sure I understand what you mean by that. What, $8 billion?
The state budget.
Okay.
I have to just quickly tell you this. I was teaching a class in Middlebury at the elder education thing, and it was on re-engineering governance in Vermont under the assumption that it stopped working. And before I just opened the class, I said, I just have one statement I want to tell you, and that is that the shareholders of Tesla have just awarded a compensation plan to Elon Musk that is 6 times larger than the entire budget of the state of Vermont.
Wow. Yeah. All right. So if you took that, say, call it $5.5–6 billion, we have 14 hospitals. So how do you set it up? What would it? I'm drawing a big globe with my hands here. What would it look like?
Well, I can't correlate what the vision for a functioning healthcare system would look like with that figure. I can only say that it would be a lot less. There's another, I want to be careful not to change subjects on you, but this is really important to say. In the Reese analysis, which Oliver Wyman, Bruce Hammery have seen and have endorsed because it's all federal data, and the hospital's been confronted with it, UVM Medical Center, and they're, you don't understand. The other fact that came out of it that is fascinating, there's this myth called cost shifting. And the hospitals say, no, we have to get this much money because Medicare doesn't pay enough to cover our costs. We've all heard that ad nauseum.
Yeah.
I'll send you an article by someone on the Green Mountain Care Board that puts the myth to that. But anyway, the hard data, all of which is national, comparing all these academic medical centers that are adjusted for bed count, acuity, outcomes, so they're all true comparisons to UVM, 71% mark, either break even or make money on their Medicare reimbursements. And there's discussion now about the Green Mountain Care Board saying that's going to be the regulatory formula. We're going to move you towards that. The Cleveland Clinic is doing it now, and they're bringing in the president of the Cleveland Clinic to talk about how that could be done here. That would lower the cost tremendously.
Do you think the Green Mountain Care Board is doing a good job?
I do.
Okay.
I do. I really do. Given where they've come from and given their lack of resources, I really do. I know their heads are in the right place. The difficulty is you need to regulate an obtuse, complex system and not break it. You need to shift its direction. They don't want to break anything. They don't want to destroy the hospital, but they want to make it so it actually delivers population health.
Because there's this whole, and you've referred to this, there's this whole effort to, and it's probably the latest in 9 or 10 different efforts to reform the healthcare system in Vermont. Why should we believe that that's going to be any more successful than the previous attempts?
Well, the real question here is, do you migrate and reform, or do you let the system collapse and rebuild? And I'm an optimist. I actually think that the system is on the verge of shattering. I wish that wasn't the case. I don't mean hospitals collapsing and going out of business, but the situation getting so dire that people say, well, maybe we have been doing it wrong. Maybe we should think about doing it differently.
Tell me more what you mean by that.
I think the hospitals have been so resistant to the reform proposed by the Green Mountain Care Board. And there's probably 75 more of us out there, many of whom you know, who are strongly advocating for healthcare reform, that see how broken it is. Those people can come together along with others, along with the heads of hospitals, and say, okay, let's reverse engineer this. Let's not sit around and point fingers and say what's broken, because that develops a defensive culture. Let's forget about what's wrong, and let's sit down together and imagine what a functioning system would look like financially. And again, it's driven by acuity. If I have a sniffle, I don't go to the emergency room. I go to primary care in Eden.
Okay. So if you re-engineer this, going back to the question I asked you a few minutes ago, so if you had no healthcare system here in Vermont and you totally scrapped what we have today, how many hospitals would we have? You say 14 or too many?
We'd probably have 7 or 8, and we wouldn't close the other hospitals. We would reverse engineer them to what their communities needed, which would probably be a sophisticated clinic. And the other thing is, people wouldn't be competing to do MRIs or dialysis or hip replacements. They'd say, okay, we're going to have one in the Northwest, we're going to have one in Central East, over here and over here, because that's all we need. This whole thing of, well, if I'm going to have dialysis, I want it in my hometown. Well, you may not be able to. Or if I'm going to have a heart transplant, I want to have it in Burlington because that's only 30 miles away. Well, no. We'll take you by helicopter to Mass General where they do 5 a week. And you know what? You'll be much safer and it'll cost less.
Today, my understanding is Springfield Hospital, for example, is not really what we would consider a hospital. It is one of these sort of glorified clinics.
Yeah.
Fair enough?
Yeah, it is. But the question is, did it devolve to that, or did we make a strategic decision? Here's what that community needs in the construct of an overall system.
And I'm hearing between the lines there that it was a devolvement, not a proactive move.
I would say so, but I mean, it gets to the point of when the feces hit the fan, do you turn the fan off? I mean, you have to do something.
Mm-hmm. Okay. All right. So then with that, are you talking about spending less money in the system? Or are you talking about, I mean, I'm just not really clear what this looks like at the end. I mean, are we going to be paying less in health insurance?
Don't talk about that.
Okay.
Talk about affordability.
All right.
What can a person living in Wolcott or a person living in Burlington, if they can afford to live in Burlington, what can they afford for health care? And again, it's important to remember we have nonprofit healthcare insurers and for-profit. The healthcare insurers are strictly regulated. The nonprofits are not. United Health and Cigna.
The for-profits.
The for-profits. Yeah, thank you. And, they can play games endlessly. The not-for-profits cannot play games. They have to pay. If the hospital bills $110,000 for heart surgery, they can say, well, are you, really? I mean, they can go back and forth. There's a thing called denial management. And I was stunned at how much money we spent when I was chair back then on a team of denial management people. And it would be the whole thing of, well, we're going to submit a bill for 110. And the insurance company says, well, we'll pay 66. And it goes, and it's an auction back and forth. And they settle on 72.
Mm-hmm.
That's all waste. That's horrendous waste. If you had global budgets, what does TAVR surgery cost for the heart? $18,000. Okay, everyone charges $18,000. Make it work.
But you're saying right now hospitals are, what I'm hearing you say is that right now hospitals are nonprofits acting like for-profit businesses.
Exactly. Healthcare is the most lucrative business in Vermont, arguably the most lucrative business in the country except for pharma, which we're loath to regulate. As I said to a bunch of, I think it was the Champlain leadership or Snelling leadership, I can't remember, a wonderful cohort of 80 really bright young people. I said, 130 countries in the world have made a decision, for better or for worse, to make healthcare a government right. Not a God-given right, a government right. We in the United States have decided it's a lucrative business. Pharmaceutical, medical instrument manufacturers, hospitals, it's too profitable. You don't want to make that a government right.
Mm-hmm.
I mean, that's the fundamental underlying issue, in my view.
How do you get the Green Mountain Care Board to get the hospitals to go back to their original mission, act like nonprofits as opposed to for-profit businesses? Or can they?
They can, and you've asked me the question that I can't answer. How do you turn the Titanic in another direction to salvage it without sinking it?
Because it seems as though the option right now is that you and I continue to pay these double-digit insurance increases, and that doesn't seem sustainable.
It's not sustainable. I mean, again, what good is quality if access and affordability aren't there? I wish there was a way to determine how many Vermonters have simply given up on health care.
Mm-hmm.
They take half their pharmaceutical dose because they can't afford it. They have just said, no, don't take me to the hospital, you know.
Well, and, talk about pharmaceuticals. I know people that are cancer patients. You go in for a round of chemo, and you know what they charge for a round of chemo?
Yeah.
$40,000.
Oh, I know.
So that seems, that's shocking. I mean, you can get a prescription for some of these chemo drugs, a 30-day supply is $20,000. And you'll have pharmacists say, well, Why are you worried about that? You're not paying anything. The insurance company is. Well, we all are.
Not true. Of course, we all are.
Yeah.
Steve Leffler uses a very common example, and I can't remember which.
The head of UVM.
I'm sorry, he's the head of UVM Medical Center, lives here in Heinsberg, good guy. The example he uses is we have one diagnosis that requires one pill, and the pill's $500,000. I have a family member who is on insulin. He's adult onset diabetic. He used to spend like $30 or something. Private equity bought the company. You know the story. And it went up to $400 or $500. He wants to use one of those monitors instead of drawing blood twice a day. The monitor is, I can't remember, it's $4,000 or $5,000, and it's $900 a month. And he's a successful guy, and he can't afford it.
All right. I think, like a lot of people in Vermont, are looking for somebody to blame. You're telling me the Green Mountain Care Board is doing its job. You know, you're saying that the hospitals are continuing on doing business the way they've always done it. You know, the insurance companies just take whatever the number is and pass it along to you and me. I'm looking for a boogeyman. I'm looking for somebody that I can hang out to dry, and there's nobody there.
Okay, there is.
Tell me who.
It is the governing boards of the nonprofit hospitals who are not holding their leadership accountable to delivery on the mission of population health. Their pictures should be in every post office in Vermont.
Wanted.
Yeah.
Yeah.
Sorry to be so blunt.
Well, that's what I'm looking for. That's why I'm here. Did these board members know enough to know how to do that?
Generally, no. I mean, I don't blame them all. I've talked to a number of them. You probably followed the thing at Copley, the president, Joe Wooden, buying this expensive software system to make his emergency room more profitable, hearing all kinds of complaints, and then sending everyone in the emergency room a letter saying you have to sign this letter saying you support my acquisition. And when the best surgeon in the thing sent him a note back saying, not only will I not sign this, here are 9 chart-based cases where this system put my clients at risk. He fired him the next day. Either 1 or 2 other doctors quit, some other people quit. The issue for me is, why didn't the board immediately pull in the president and say, explain to us what happened?
One of the other things that has been going on in healthcare in the system of late is the UVM Health Network, where, you know, it used to be that it was, you know, Fletcher Allen that you were the chair of. All the other hospitals are kind of on their own. But now, and maybe I'm wrong on this perception, but it seems as though UVM has been allowed, and again by the Green Mountain Care Board, to go and affiliate or buy up or whatever they do.
No, they wholly own them.
And I'm sure they do it on the pretense of the more we own, the quote unquote more efficient we can be. We can buy masks in bulk, whatever. But on the other hand, that seems like it's creating a monopoly. So why did the Green Mountain Care Board allow that?
You'd have to go back to the point at which that happened. And that was not the point at which the current Green Mountain Care Board was operating. That's the acquisitive model. If you want to grow a massive business, you know, and have operational scale and control more and more and more revenue, that's what you do. That's how a business behaves,
right?
Not a nonprofit. One of the strangling problems is, from a regulatory standpoint, how do you regulate the UVM Health Network that has Vermont hospitals and New York hospitals? Where's the money going? Is money being made in Vermont off Vermonters at the UVM Medical Center and being sent over to a New York hospital to keep them afloat? That whole auditing system is opaque, and it's one of the questions the Green Mountain Care Board is asking.
Because the UVM Health Network has got, 3 hospitals over on the New York side that they own.
Right.
Right. Okay. All right, let me ask this question another way. How close is the Vermont medical system to breaking?
It depends on how aggressively the Green Mountain Care Board increases the temperature. And that's what's going on right now. I mean, the Tom Rees data, which I'll send you, was presented to Jenny Samuelson at AHS. She was stunned, and she said, okay, we're going to present this. I'm going to present this to Dr. Eppen at the UVM Health Network, and I'm going to ask for an explanation. They did. They had that meeting, and another meeting was set up because, to be fair, they have to be given a chance to respond to that data. Is something wrong with this? It's all national data. It's Medicare data. But are we reading it wrong? So there was a meeting, I think, last Monday with Rick Vincent, who's the CFO. I've heard part of the outcome, which is you don't understand, it's too complicated, you don't get it, we need to make all this money. It was the typical stuff. But have they responded specifically to that data and the accusation that from a standpoint of how much money they spend on clinical care versus administrative and management being one of the worst in the country? They haven't explained that, and they haven't explained where all this money they need to make goes.
Okay, so it doesn't seem as though there's going to be one easy problem for me to point to say this is what needs to be fixed. So executive pay, that's an issue, but that's not...
Executive pay, and even more than that, the number of executives, the number of administratives, the number of non-medical personnel, that's a real problem, really a serious problem. And when compared to other academic medical centers, as I said, adjusted for acuity, bed count, so there's a true comparison, they're a mess up here.
Okay, but that's not going to get me to a point where my health insurance isn't going to go up in double-digit increases every year, right? You're shaking your head no.
Yes, I'm sorry. I
can't do that.
No, I know how quickly we forget. Yeah, I mean, I'm shaking my head no. And if I had to point to one problem, I would, perhaps with the Vermont Community Foundation, create a course in nonprofit board governance in the medical system. And I would require every single board member to take this course. Maybe it's half a day, maybe it's one day. And it's not rocket science. I mean, as I said, I've chaired a lot of organizations. You can explain the obligation of a nonprofit trustee on half a page, but you have to do it. You have to understand it and you have to do it. And it's very simply holding the president or leader accountable to delivery on mission.
But how do you do that if you're, I don't want to say an average person, because an average person isn't going to be on these boards, but I would imagine that if you're on a hospital board, you're looking to the experts, which are the people running the hospital, to say, and you say to them, so where can we cut costs? Where can we get back on mission?
That's all good. That's fine. You know what a performance review is. You do a 360 performance review every year that includes the leadership themselves. You includes the community leaders. So everybody's feeding into this, constituents, and you put that together and you bring that, to the leadership and say, you need to explain this to us. How are you going to fix this? Because if you're not, we're going to find someone who does. And you say the average person serving on a board, you do what the Green Mountain Care Board is. You bring in the president of the Cleveland Clinic to explain how they're going to manage to Medicare. You bring in the head of Geisinger, who managed to pull tons of waste out of their system, or any number of places that have done this. You don't reinvent the wheel. Boards have that obligation.
Do you think anything's going to happen with these recommendations in this report that Tom Rees did?
I do. I do.
Why? That would seem as though it would be a change from what's happened before.
Because it's really hard to argue with data. You can say, which the UVM Health Network frequently does, you don't understand, you don't understand, you don't understand. Okay, I don't understand. Explain it to me. Data doesn't lie. You and I both know that if I'm CEO and I want to do something and I can say to you, hey, bring me some data that supports where I want to go. You can do that, but not if it's vetted by a lot of people or it's national data. Data that's derived from the Center for Medicare, CMMI, Center for Care for Medicare and Medicaid Innovation.
All right, well, let me try this theory on you. I wonder if part of the problem that these nonprofit boards are having are the same problem we all have when we go to a doctor and we say, I'm sick, tell me what I should do. And you rely on them to be the person that's going to solve all of your problems.
That's a cultural problem. Any wise person advising someone on that will say, if you go to a doctor or you go to a hospital, you need to be either your own advocate or you need to have an advocate with you who asks the tougher questions.
Right.
If you're coming in to a hospital with a migraine headache, maybe you're not thinking about what are the questions I have to ask? So you have to have someone with you. But the point is, just as you consulting with anybody, you don't go to a financial advisor, you don't go to a healthcare advisor, you don't go to an attorney and just say, help me. You have to check the information you're given or you have to have an advocate who will help you.
All right, well, so how do we change that culture? How do we change that for board members so that they feel more empowered to ask the right questions? How do we do that?
The only thing I know would be to have, if you're going to serve on a hospital board, you have to take this 4-hour course in what that means.
Okay, but those people are sort of self-selected, and the hospital, I would imagine, has some...
Well, this is a horrendous problem. Who picks the board? If the hospital, which in many cases they do, I've got a friend in Rotary who loves what we do. Let's put them on the board. It doesn't work that way. Every nonprofit board has a nominating and governance committee. They have a list of the kind of people they need to do their job properly. Some of governance, some of it's capacity, just money. Some of it's finance, some of it's legal. You have a list, and the nominating and government's called a self-perpetuating board. The board chooses the people it needs to do its job. The hospital doesn't. And that's one of the part of the systems that's horrendously broken.
And that's what's happening now.
Oh, yeah. I mean, I don't want to generalize and say it's happening everywhere, but it's happening way too much.
All right. So who's going to be responsible for making that change? I mean, who do we hold accountable for making these boards better? Because it seems as though that's water that's just going to keep flowing downstream. No one's going to challenge that. I mean, maybe you can write a column or two saying it's wrong, but, how do we get... Is it a political leader?
People generally agree it's wrong. I think the right place for it is the Vermont Community Foundation. Since they do so much work with nonprofits, I think the natural group to take that leadership position would be the Vermont Community Foundation. They might do it with UVM, they might do it with Middlebury, and just say, okay, we're going to put together a curriculum. I mean, it's like, what's the group that does that for new legislators? Mm-hmm. Snelling, I think.
Right. Yeah. Snelling Institute.
Yeah, the orientation, I mean, I think that would be a really good move. And part of that would be understanding that, no, the hospital doesn't pick their own board members. Because if I'm the head of, the hospital and I pick my buddies who I like and, who are going to do what I tell them to do, there's no governance.
I can hear right now the hospital saying, well, I mean, we've got a state with a demographic that is skewing older. We've just had a pandemic that has required an enormous amount of health care. We can't maintain the right and quality of nurses. They're all going somewhere else. There are all these things that are out of our control, and we're going to just keep doing things the way we're doing them. And I mean, I just don't know how you challenge that.
The first part of your statement is absolutely true. And I say this often, and it's bewildering to people. Everything is connected. Healthcare, housing, nutrition, food systems, criminal justice, education, they're all connected. They all impact one another. So it's a very fair question. Do we want to expect the Green Mountain Care Board to build low-income housing in Burlington so the hospital can, hire nurses? That's why Bill Mayers put together a book before he died, which will come out, I think, in September, October. It was called What Will Vermont Look Like in 25 Years? And I was asked to write a chapter on it. My first reaction was to just be humorous and say, given climate, we'll be the naked ski capital of the East or something stupid. But instead, I took it very seriously. And I basically started it out by saying, in the year 2030, our 200-year-old system of governance no longer worked to solve the problems. So a group was put together to re-engineer the executive, legislative, and judicial branches so that they could deal with the issues that we have today. And then I described it.
Do you think that the healthcare system, I've heard the phrase from business consultants who talk about breakdown to breakthrough. Do you think that the healthcare system here in Vermont is going to implode, it's going to break, and then we put it back together again? Or is there really a way that you talked about before where we can change the trajectory here, get some reform, change the way the 14 hospitals are operating before we reach that point where we almost go past the point of no return, what people talk about with climate change, for example?
Yeah, I do think that's possible. I don't think hospitals have to shut down and go out of business and, we have to destroy the infrastructure and rebuild it from scratch. But we have to have a recognition that the system is so broken and so close to collapse that we change our point of view and say, okay, we're willing to reverse engineer this. What are the goals? What are we trying to achieve? Population health. What is population health? Okay, that's going to be the driver of our redesign.
Okay, but just like climate change, the temperature goes up. We've seen all these floods. We've seen increased, the hottest year on record every year here in Vermont. It just seems to go up a little bit. We have going back to health insurance, we have these increases every year. Well, I'm going to have to dig a little deeper into my pocket. That doesn't seem to be the way humans work. I mean,
okay, I'm going to hit that head on. It really comes down to leadership, and we don't have leadership. We haven't had it for a long time. I've talked with a lot of people about this. I give Governor Scott full credit for being a crisis manager. He did the right thing in COVID. He is under no stretch a strategic manager. We've had very few leaders who are strategic managers. They understand the interconnectedness of these 8 beats, as I call them. Criminal justice, food systems, housing, healthcare, education. They don't understand the interconnectedness, and they don't know how to have the discussion with the people of Vermont who feel it. And I would argue that the people of Vermont are ready for leadership. They're ready to have somebody talk honestly with them because they've experienced the flooding. They've experienced the fact that they had to wait 8 months to get an appointment with a urologist. It's not going to be alien news, but there has to be a leader who has the courage to say, I'm not focused on power and authority. I'm focused on making this a better world. So I'm going to tell you the truth. Here's what's going on. Who's with me?
Because as you were talking about this earlier, I was thinking of the term czar. We always talk about, well, let's bring in a healthcare czar who's going to sort of try to lay out this whole big picture. I mean, you're talking about so many different things that are all interconnected. But, again, I go back to what I said to you earlier. We seem to be, as a species, reactive in nature.
Of course,
Nobody
we are.
nobody does anything about their health care until
But
they have
that's
a
a
heart
vacuum
attack.
of leadership. Can you imagine a governor standing in front of the people of Vermont and saying, look, in these 8 beats, in these 8 areas, here's where we're breaking down. You feel it, you know it. We're going to put together the best thinkers we have in this state to understand how to do this better. It's leadership. We don't have leaders. And in many cases, we don't want leaders because they do tell the truth. The true leader does. We'd rather have somebody who cuddles us. There are people who are out there. There are people who are natural-born leaders. We just need to get them into positions of power.
That wraps it up for this edition of 802 News, sponsored by Red Hen Baking Company. Thanks for listening.